Okay, I want you to imagine a race against time, but it's happening inside the tiniest, most delicate human eyes. That's pretty much the reality of retinopathy of prematurity, or ROP for short. It's a condition that threatens the sight of the world's most vulnerable infants. Today, we're going to break down this leading and, often preventable cause of childhood blindness. So let's start with a number that really frames just how urgent this problem is. 20,000. That's the estimated number of infants who are blinded by ROP every single year, all around the world. It is a staggering figure, and it highlights exactly why we need to understand this condition. So here's our roadmap for today. We'll kick things off by figuring out what ROP even is, and then we'll dive into the kind of chaotic way it develops. We'll look at how doctors spot the danger signs, compare the powerful treatments they use to fight it, see how this battle looks different across the globe, and then finally, we'll talk about the lifelong journey these kids face. All right, let's get down to the fundamentals. Before we can really get into the fight, we need to know what we're up against. So what exactly is retinopathy of prematurity? Okay, so at its core, ROP is a disease of development just gone wrong. See, in a full-term baby, the blood vessels in the retina, they have plenty of time to grow nice and calmly all the way to the edges. But in a preemie, that whole delicate process gets interrupted, and the eye's reaction, well, it can be totally catastrophic. The way ROP develops, it's really like a two-act drama playing out inside this tiny, developing eye. It's a story of, first, an interruption, and then a massive overreaction. So in Act 1, the baby's born early, and that sudden switch to the oxygen-rich world, the NICU, which, by the way, is absolutely essential for their survival, it just hits a giant pause button on normal blood vessel growth. Then comes Act 2. The retina, now realizing it's starved for oxygen, starts to panic. It sends out this desperate SOS, which triggers a chaotic, dangerous burst of brand new and very fragile vessel growth. And here is the main culprit right here, VEGF. You can think of it as the gas pedal for blood vessel growth. In a healthy eye, it's used with a lot of control. But in ROP, that oxygen-starved retina just slams the pedal to the floor. And that's what drives this whole dangerous disease process forward. With all this chaotic growth happening, how in the world do doctors make sense of it all? Well, they've developed a really precise system to classify what they're seeing, and it's absolutely crucial for deciding when it's time to step in. Doctors basically use three key metrics, almost like a set of coordinates to pinpoint the problem. The zone tells them the location, and zone I, that's right at the center of vision. That's the most critical area. The stage tells them how severe it is, and then plus disease. That tells them just how aggressive the condition is right at that moment. This progression is exactly what doctors are watching for, week after week. It starts out so subtly, with just a little line, but that line can turn into a ridge, and then from that ridge, those dangerous new vessels start to sprout. And if you don't do anything, they can actually pull on the retina, leading to detachment in stages 4 and 5. And that's what causes blindness. Okay, this right here is the most urgent signal of them all. Just look at the difference. On the right, pre-plus is a warning sign, for sure. But on the left, plus disease, I mean, look at those thick, twisted, angry-looking vessels. That is the fire alarm. It means the disease is in high gear and treatment is needed like right now, usually within 48 to 72 hours. So when that alarm bell rings, doctors have to act fast. And today, the fight against ROP really comes down to two main strategies. You've got the established gold standard, and then you've got a newer, more targeted approach. Let's put them head to head. On one side, you have laser photocoagulation. It works by making these tiny, controlled burns on the parts of the retina that are starved for oxygen, basically to tell them to quiet down with those VEGF signals. It's often a one-and-done treatment. On the other side, you've got anti-VEGF injections. This is more direct. It's a medicine that gets injected right into the eye to block that VEGF chemical we talked about. The big upside is it saves peripheral vision, but there's a risk the ROP might come back later. And hey, the data really shows just how effective these treatments are. The landmark Rainbow trial directly compared a key anti-VEGF drug, called ranibizumab, to laser treatment. And what it found was that 80% of the infants treated with the injection had a successful outcome. Compare that to 66% for those who got the laser. This trial was a total game changer, really establishing injections as a powerful first-line therapy, especially for the most severe cases. Now, the experience of diagnosing and treating ROP is not the same everywhere. Not even close. The story looks very, very different depending on where in the world our premature baby happens to be born. This is a really fascinating comparison. In the US, the screening guidelines are super strict. focusing only on the smallest, most premature babies. But in India, where neonatal care is improving like crazy, they screen bigger and slightly older preemies. So why do they do that? Well, they're basically casting a wider net to catch every possible case in a system that has fewer specialists and more variation in care. It's a really smart, pragmatic adaptation to the local conditions. And that is the absolute core idea here. In India, there's a program called ROP that uses technicians in rural NICUs to just take pictures of babies' eyes. Then they send those pictures to experts in the city for diagnosis. This simple telemedicine model has screened over 45,000 infants. Think about that. It saved the sight of thousands of kids who would have had no access to care otherwise. It's a perfect example of this quote in action. Okay, finally, what happens after the immediate danger has passed? Saving a baby's sight from ROP is a huge, monumental victory. But for these kids, the journey is often lifelong. The thing is, even with a successful treatment, the eye is forever changed. These children face a much higher risk for things like severe nearsightedness, crossed eyes, and lazy eye. They also carry a small but very real risk of their retina detaching years or even decades later. And what that means is they need specialized eye care for the rest of their lives. And this is where that choice of treatment back in the NICU has these profound long-term consequences. Study after study shows that infants who get anti-VEGF injections are far less likely to develop severe nearsightedness compared to those who get the laser treatment. That is a massive advantage. It's not just about saving sight in the moment, it's about the quality of that vision for a lifetime. And this really brings us to our final thought for the day. The miracles of modern medicine mean we are saving babies who are smaller and more premature than ever before. But with that incredible success comes this profound responsibility. The challenge moving forward isn't just about survival anymore. It's about making sure every single one of those survivors has the chance to see the world clearly.